I was in university. I'd been suffering with these sort of crazy attacks of fear and panic for a while, for about 2 or 3 years. And I was studying psychology and biology myself. I was in life sciences. So I diagnosed myself as potentially having anxiety disorder or panic attacks. And I went into my medical doctor at the campus health center to sort of ask for my options. I had done my research, and it seemed that CBT, cognitive behavioral therapy, was the way to go. Except that when I got there, my doctor kind of said to me, do you really want a psychiatric evaluation on your medical record? And it was the first time that I was ever really hit with, the stigma that's associated with mental disorder or any sort of mental emotional health issues. And it was really, really kind of eye-opening for me at such a young age. And so she just kind of sent me away, telling me to sort of cut back on the caffeine, just a regular, university student. And she gave me, this is in Canada, she gave me a sample, like a month's supply of a very common antidepressant. And I was like, okay, now you've given me some antidepressants, which I know are known to cause weight gain. And weight gain was one of the things that I was trying to actually talk to her about, because at the same time that I was having all this anxiety, my weight was sort of just steadily increasing. And it seemed to be increasing at a lot faster rate than my friends, the rest of my friends, like my good group of friends. And we used to all hang out together. We'd eat the same foods. We would go to the gym together. I was pretty active for a young woman, but I was still sort of steadily gaining weight, and I was having these anxiety attacks. And so I knew I didn't really want to do, I didn't want to take antidepressants. To me, they just did not seem to be the answer. So I started doing my own research, and I wish I could remember exactly what it is I was doing. I think I was working on an assignment for one of my psychology classes, and I just sort of came along this website that had listed all of my symptoms, all these symptoms that I'd been living with for about 2 to 3 years. The sort of panic, the anxiety, the fear, without any reason, without any specific, specific particular reason. Yeah, without trigger. Yeah, exactly. Just sort of this baseless, groundless fear. And so I had the fear. It talked about the anxiety. It talked about a little bit of weight gain or fluctuations in weight. It talked about feeling more hungry than normal. And I did sort of feel hungry all the time. It was only like my willpower that stopped me from eating pretty much 24/7, and gaining weight despite being active. And then the last sort of thing that cinched it for me, or clinched it for me rather, was it described trembling and almost like having like convulsions of the body, and almost and blacking out or losing consciousness if it got to a really bad point. And I read all those symptoms, and I said, oh my God, this is me. This is what I've been facing for the past 2, 3 years. Like, hallelujah, why didn't somebody figure this out for me? Why didn't my medical doctor figure this out for me when I listed all of my symptoms? And what it was hypoglycemia, or severe low blood sugar. So I realized, in sort of going back through my family medical history, that, my entire father's side of the family has a lot of diabetes issues. And I realized that I was already starting to experience some of this dysregulation of blood sugar. And this is what must be happening. So I started doing my research, because I said, okay, well, there's no way I'm going to go on like blood sugar medications or antidepressants. I'm going to try to figure out what to do, because I knew that the very first step in controlling blood sugar was diet and lifestyle. So I started doing my research, and the simplest things seemed to take such a great effect because I was so young and because I was otherwise pretty healthy. I had a healthy lifestyle. I was active and I liked to eat well. I already, ever since high school, I already kept a food journal, so I knew what it was I was eating throughout the day. And I just realized that if I just tweaked what I was doing in terms of adding a little bit more protein, more fruits and vegetables, cutting down on the carbohydrates. I already wasn't a fan of having things like pasta or rice because I knew that within 20, 30 minutes of eating something that was so hard, so rich in carbohydrates, my body felt weird. Like I just felt very unsettled and disquieted, and I now realize that that's one of the biggest symptoms when you have reactive hypoglycemia. When you have a big carbohydrate meal, you have a huge crash in your sugar levels, within an hour or so after eating. So it was really amazing at the age of like 19 or 20 years old to be so empowered, to feel like I was finally in control of what was going on in my body. I did some more research and I realized that the supplement chromium picolinate is actually really, really effective at helping to stabilize our blood sugar levels. And chromium is often very, very deficient in the North American diet. So I started adding that in, and it seemed to do really, really well. And so it was through this journey that I really started realizing that, okay, the kind of doctor that I envisioned myself being, the one that I had wished I had been able to see, was not a conventional medical doctor, because they just don't always have the time to sit with you and really go through your symptoms and try to put together, the different threads that make up the tapestry of what's going on for you. And I discovered what naturopathic medicine was, and it just was the perfect fit for me, because it seemed like I could just get to be a detective for the rest of my life and try to figure out what was going on with people and share my experiences, and connect with patients and tell them, listen, I've been through it. I know it's difficult, and here's what worked for me, and here's what my research has shown. So that's kind of my story, I guess.
Okay, and what kind of people look for you? What type of patients, or how do you help them?
I work strictly by referral at this point. I don't do very much. I don't do very much marketing. I think, although this journey with the One Crazy Broccoli might change that. But I do work mostly by referral, and I think I get sort of all sorts of people. And it's amazing because my clinical specialty is actually chronic and acute pain management. So people come to me often with sports injuries or long-term back pain or migraines, any sort of pain that's been going on for a really long time that they haven't been able to get to the root of. And I do my best to treat their symptoms. And when they do feel a little bit of relief, they start trusting me. That's when I start talking to them about the deeper issues that could be going on. The more sort of the root of the problem, the more long-held patterns that their body is suffering from. So that's usually how I practice. My practice is fairly open. I've treated anywhere from children to the elderly. As I said, I do like working with athletes, and I like working with people who are more active because their bodies are more responsive. they're sort of already on the way to health. They're on board, so it's easier to try new things. But in general, I really like working with a broad patient base because it kind of challenges me to continue to research and to continue to grow and continue to learn.
So it's usually chronic pain?
Yeah, a lot of times chronic pain. But I find chronic pain is often, how do I put this? It's the surface, right? A lot of times chronic pain is only a symptom of what's really happening inside. And internally, once we fix the physiological stuff, once we fix the structural stuff, once we fix the biochemical stuff through nutrition and diet, a lot of times people are just left with their emotions. And I find that I've seen over and over again that the body remembers what the mind tries to forget.
Mm-hmm.
And so a lot of times what the pain that we're feeling or the pain that my patients come in with is actually linked to traumatic experiences that they've had in their past. And once we connect the dots and once we get that sort of aha moment, like, oh yes, my migraine started when I had that terrible job where my boss was horrible and emotionally abusive to me. Once they make that connection, and we've worked with everything else, the structural, the biochemical, the physiological,
Mm-hmm.
mental emotional aspect takes over, and it becomes a wonderful healing journey because they get to the roots of what their body is really trying to tell them.
So you work with them also in an emotional level.
Yes, I
Yes.
think so. I think I start with the physical level and I just keep going deeper and deeper and deeper and deeper. I think when we were in school, one of our teachers described the process of sort of, peeling an onion.
Mm-hmm.
You take the layers off and you take each layer off and each layer off and you get deeper and deeper to the core, to the essence of what's happening.
Mm-hmm.
And often it's a mental emotional issue.
Okay. What rewards you the most as a therapist in your practice?
Helping people to connect the dots. I think so often, like myself in my own story, so often we go around and you know, if we could just name what was happening, if we could just figure out when it all started, things would be so much easier to deal with. And I think I really enjoy doing that with patients, just helping them realize that, they don't have to live like this for the rest of their lives. Whatever pain they're suffering from, whatever illness that they have, we can figure out where it started. We can try and figure out how it started and how to address that initial spark that went wrong. So I think that's the most valuable, like the most satisfying thing that I do in my practice is helping patients sort of reconnect with their bodies and reconnect with the things that have happened to them and the consequences of those events.
And what challenges you the most?
Challenges me the most. Um, I think the most challenging thing is learning to connect with each patient.
Mm-hmm.
You know, finding finding a way to finding a way to sort of speak to their soul, speak to their essence, and try to bring them on board. Because my job is not to heal you. My job is not to correct what's going wrong with you. My job is to teach you how to do that for yourself. And I think there's a lot of trust that needs to be built in that relationship before patients can feel empowered and feel as if they are able to do this. And so I think that's for me the most challenging is trying to figure out how to bring my patients on board with that understanding that they hold the key. It's their power that I'm using or that I'm calling on. So I think that is the most challenging thing.
And when you encounter patients that at the beginning they don't trust you or they don't trust alternative medicine because there are a lot, how do you try to convince them or to talk to them?
I think because I come from such a sort of strong scientific background, my undergraduate was in biology and psychology,
Mm-hmm.
and then I did 4 years of naturopathic medical school. And after school, I actually, when I was studying for my licensing exams, I actually started teaching. So I started as at one of Canada's largest universities, and I was teaching. I was teaching histology, pathophysiology, physiology, and sort of other very basic medical sciences.
Mm-hmm.
So having to explain complex, uh, uh, very large, complex, abstract concepts to students was a really good way for me to learn how to break down, the more difficult concepts that we face when we're trying to explain health and healing, like what's actually going on in the body, and put it into words that people could actually understand, that my students could actually understand, and that they could connect to what was going on with their own cell, with their own bodies, and what they'd learned in other previous courses. So I think that background of teaching really helps me to be able to sort of break down the science for people and say, okay, well, this is physiologically what's happening in your body. This is structurally what we want to see, and I think that really a lot of my patients appreciate being able to have a concrete understanding of what's going on. I don't just talk of I don't I don't talk in abstract concepts. I try to make it very very real for them. I draw often, like I'll draw what's going on in their intestines or in their stomach. When we're talking about digestion and clinical nutrition, I'll just go into I'll pull out a whiteboard and start drawing for them the stomach lining and how certain things are important for us. So I think I just make it I use that teaching background to help explain things to my patients a lot more, and they get on board with that. Because often it's the first time anyone's taken the time to explain this stuff, right? Medical doctors don't have time to explain this. They just give you the pills and send you out the door, right? With naturopathic doctors, we're able to actually explain to you, well, why is it that I want you to take this medication? Or why is it that I want you to take this clinical supplement?
Mm-hmm.
It really makes a difference to people.
Do you encounter a lot of clients that just want like a pill, a magic solution?
Of course, don't we all? Don't we all just want a magic pill? Give me a magic pill to make everything go away. I do. Obviously, people come in and they expect miracles, and I think that's why actually I use acupuncture so often,
Mm-hmm.
because acupuncture can be very quick acting. So, if they're coming in for pain, I will often start with acupuncture because I know it's quick acting and effective. But I explain to them, this is only a bit of a band-aid. This is short term. We need to address everything else underneath so that your body can take over the job that I'm trying to do with acupuncture. And I found that more often than not, after 2 or 3 treatments where they feel better and better, they get on board. They're totally ready to accept the difference, the different things that I want to try, the different strategies, because they understand that I'm not trying to make sure they come in and see me every week. My ultimate aim with my patients is I don't want to see you again. I want to be happy and healthy and out the door, right? So I think patients can connect with that as well.
Okay, that's good because sometimes you don't trust that on people. He just wants to see me again and again, and never stops.
Yeah, and that's exactly, and that's not what I'm about. I'm about trying to get you happy and healthy. And sure, every once in a while you might have to come in for a bit of a tune-up, but who doesn't, right? We all need to maintain our bodies. It's kind of like taking care of your car, right? Everybody uses that analogy. You hope that most of the time it's okay, as long as you feed it the good proper nutrition that you need.
Mm-hmm.
But once a year or so, you need to go in for just a quick adjustment or a tune-up, and then sometimes you get into like bigger issues, but we at least we have a better understanding of those issues as they come up.
Exactly. Could you describe your practice or your journey in one word?
One word? Oh my goodness.
To start with.
To start with. Um, Integrative.
Okay.
Integrative.
Why integrative?
Because, well, for 2 different reasons. The first reason is that, one of the reasons I was always interested in alternative medicine when I was younger is because I truly believe in the integration of the mind, the body, and the soul. We have to be complete 3 and 4 dimensional beings. We're not just living here on a body level. We're not just living here in our mind. And it's not just our hearts and souls that do our living for us. We are an integrated system, and that system works together beautifully. Right? So I think integrative is a big, big reason why I became a naturopathic doctor. And then from the other perspective, I think of my work as integrative because I don't see myself as being opposed to medical doctors.
Mm-hmm.
Um, I see myself working with conventional medical doctors, to bring people to their best state of health. There's often times that I recommend that patients go back to their doctors for surgery or even other prescriptions because I truly feel that that would be the best option for them. And I
Okay.
think that that integration of services puts the patient's best interest, first and foremost.
Mm-hmm.
A lot of times my patients will come to me and say, oh, my doctor is recommending surgery for this and I'm really scared. I don't really want to do it. And I'll sit with them and I'll go through the options and oftentimes I'll come to the same conclusion as their medical doctor because sometimes it is the best option. If God forbid, if I break my leg, I want to go to the emergency. I want to get a medical doctor to set my leg and put a cast on, right?
Yeah.
There's a time place for all of us
Mm-hmm.
in in the healing journey, whether it's medical doctors, naturopathic doctors, your chiropractors, your massage therapists, your Reiki practitioners. We really need to address and integrate
Mm-hmm.
the whole system. So I really think integrative is the word for that sort of guides my practice.
Okay. Thank you. Thank you very
Thanks.
much, Maral. Um,
Thank you, Sophia. It's been amazing to speak with you.
it's been amazing too.